This conference will now be recorded.
Sorry about that.
That's
Uh,
okay.
it's been one of the conversations that I've been having with the American Diabetes Association. When we started all these conversations on diabetes, I approached the American Diabetes Association, and I'm now part of the primary care work group, that they have in place. And one of the things that they ask, that I always ask, is to provide feedback from the health centers in regards to the type of treatment, to the type of training that health centers are looking for. So this is very helpful. In fact, one of the things that we are trying to do is we are working on developing content for our next national conference. And one of the ideas that we have is to invite the American Diabetes Associations and go over some of the trainings that they have. So this one on treatment and treatment protocols seems that is one of the needs that you have in Wichita Falls.
That's
So
correct.
I'm going to take that in mind. I'm going to keep that in mind and talk to the people at the American Diabetes Association. I will keep you posted. If this is not something that your staff can attend, what I can also do is do a webinar, and invite the
Uh-huh.
American Diabetes Association to present on this particular topic. So this is very, very helpful. Thank you.
Okay. Very good.
So who else have different needs?
This is Sonia talking from Maestra. Thank you so much, Dr. Leon, for putting this together and starting the conversation. So I guess one of the areas that I think we will benefit here, La Maestra, so kind of like going along the same line that Vicky was saying, is standardization. So in her case, standardizations of treatment protocols. For us is and in fact, I'm reviewing right now as we speak, what we do. So the pre-visit planning is something that we are doing in our organization. However, what my issue is here is try to standardize the pre-visit planning protocol or the pre-visit planning like sheet that we have for each provider is different. So each provider wants something different into their pre-visit planning. So we're trying to work with them and make sure that we standardize for everybody so that we're able to not only be ready for the visit, but also to address the gap in care as we identify them before the patient comes. So standardization would be something that I would say, and second is manpower. So I have a case manager and medical assistant working together. However, because we have specific dates that we focus on the patients that have hemoglobin A1C is higher than 9, we want to make sure that everybody has the pre-visit planning ready for the appointment. So I'm struggling with finding time for my staff to complete the pre-visit planning because we're customizing for each provider. So if we can have an idea of, if somebody has a good pre-visit planning template that has satisfied the needs of all the providers, I think that would be something that I would like to see as well.
Excellent. Thank you, Sonia, and good morning.
Good morning.
This is really good. So basically is one of the needs, if I understand this correctly, is the standardization process when you are preparing for the patient's visit, right? And you're looking for a planning template that can be used for or that can be given to providers.
Yeah, so I have a template that I have that we have made is homemade. That's what we have done. However, I want to see what other practices are out there that we can kind of compare and see, because at this point our template is very customizable depending on the provider. However, that is quite time consuming. And I'm trying to work with my EHR provider to see if we are able to have a template that's customizable according to the provider so that there is less manpower and a little bit more of automatization if possible. So I don't know. I'm sure there are many tools out there. I just want to, see if what we're doing is, is just extra work, or is everybody kind of in the same boat that we are.
Excellent. Thank you, Sonia, this is very helpful. Just a quick question. Is this template that you have right now embedded in your electronic health record, or something that is in paper? How does it work?
So no, the way it works. So the way that we have decided to move forward with this is, we had a meeting with all the providers that are taking the diabetic patients with hemoglobin A1Cs higher than 9. So the way that it works for us is the mid-level providers usually just take their panel patients, their diabetics, their control. If we see that there is a patient, if we're doing case management, we see there is a patient that hasn't been able to get control. So we usually have an MD working with that particular patient. So what we have done is we have customized the template, and it's not embedded into the EHR. However, we will be, that's what I wanted to see, because if there is a template that could be embedded into an EHR, so we will move forward with something like that. At this point in time, we use our population health management tool. And we tried to get as many of the areas that we wanted to see in that previous planning, but other areas we have to get them out manually from the EHR to complete that previous planning.
Excellent. Thank you so much, Sonia. This is very, very helpful. And you also mentioned some issues, right? Manpower. Is there a need for staff training? Related issues that you are seeing.
So, and I'm sorry, doctor, you got cut off a little bit. So I guess the question was that if you think that there's need for staff training.
That is correct.
Yes, I do believe that there is a need for staff training, specifically for case management. So we have case managers here at La Maestra. We have case managers that are at a nursing level, and we also have case managers that are in MA levels. So I think because we do case manage several chronic conditions, I feel that, yes, absolutely, we will benefit. Community health centers in general could benefit from some education for the case manager. So what I did is I took it up on myself, and I sent my main case manager for education, especially how to support the medical providers, and also how to educate the patient so that we are able to engage the patient in their own treatment as well. But because of it is expensive. We have to pay for that particular training, and the lack of time because we're all swamped with patients. I think not everybody's trained the same way, and some other case managers have not only diabetes but also have hypertension, have other chronic conditions they're managing. So yes, I think this will be beneficial training for the case managers.
Excellent. Thank you so much. Anybody else with a different need that would like to provide us some feedback? All right. So this is really good. Thank you so much for this feedback. I mean, this is one of the ideas that I am planning, or that I have, and I'm planning to develop. Probably to have a conversation, like some kind of conversations regarding the needs that the health centers have, because what I have noticed is that we are providing different kind of topics, and we have developed training based on some kind of protocol from other organizations, but it's better to hear your needs so we can develop a tailored training. I believe some training activities that are more useful for your needs. So this is extremely helpful. Now, in regards to patients, there are always, regardless of all the activities that you are developing on diabetes, all the programs that you may have, there always the need to provide training or to provide resources to patients too. So the question is, what are the main challenges for patient compliance, specifically medication adherence or loss to follow-ups, or any other needs that you see? You know, it will. My experience as a physician, I've been working with the Hispanic population for many years, for instance, and it's if I could attend like a round table and talk about this topic, I would say that one of the needs for the Hispanic population is to provide better education on nutritional issues. You know, the diet of Hispanics in general is very rich in carbohydrates. So and sometimes you need to have a conversation with your patients in regards to what a carbohydrate is, because they sometimes people understand that it's only sugar or the or sodas or chocolates or candies. They do not realize, for instance, that beans, rice, and other food that is part of their daily diet is always rich in carbohydrates. So that's in my case, my experience, you know, and if somebody comes to my office and asks me what are the needs of your patients, for probably the education and continue to provide nutrition programs is very important. And I understand that most of the health centers participating right now have developed these kind of programs. But in general, if we were having this conversation, you know, with other organizations and they asked you what the needs are for what the needs of your patients are, I would like to hear from you and see whether it is again compliance or medication adherence, or the patients are not coming to the follow-up visits. What are you seeing?
This is Vicki again. This is Vicki again. Can you hear me?
Yeah, we can hear you, Vicky.
Okay, very good. Thank you. So one of the things that we are doing in our center right now is we are screening our patients for food insecurities, because we have recognized that that is part of the non-compliance issue, is because many of these patients can't afford a good, healthy diet, and they don't know what a good, healthy diet is. And so we have been screening them for food insecurities and then connecting them with our local food bank and some of the pantries and things like that, you know, to help them out. And so that has really helped us a lot in that respect. But we know that that's one of the factors. And so we are actually doing a research program right now to identify where some of these barriers are at, to help to find ways to resolve those issues. And so we have about 75 enrollees right now into our program to put them in different categories. And we're trying to see what interventions are going to work the best for those to get those to be back to be compliant again. But we've recognized right off that food insecurities is one of those issues.
Okay. So are you in the process of developing any program to address food insecurity?
So the biggest thing that we're doing right now is we're using the screening tool right now to identify those. And again, getting them connected, we get them connected with the food bank when we recognize that there's a positive finding, meaning that if they answer one of those that they're having issues with this or this, there's two questions I believe that you use for the screening. And if they are identifying food insecurities, then we're giving them a voucher type thing to go to the food bank.
Excellent. This is great. Thank you.
So that right there is probably something that when you talk about training, that is probably something that would be a good area for training to be done on for health centers.
Okay. Yep. For the security. Okay. And what about medication adherence? Do you have any issues with medication adherence, or patients not coming to the follow-up visits?
Yeah, so the biggest thing that we have, they're pretty good about taking their medications. I would say pretty good about it. But what we see is the lack of follow-up. The
Okay.
providers order the patient to come back, say, in 3 months or whatever. But we find that many of those fall to the wayside and they don't come back. And we do the health, we do the phone call reminders and all that kind of stuff. But there are people that just still don't come. And then what happens is either A, they cut in line by coming in as a walk-in for it to get like our what we call today care, which is like our urgent care or whatever. Anyway, they get sick and they come in because they didn't take their medicine, So it's kind of a catch-22 because what happens is they don't come in for their follow-up, but then they end up coming in sick because they didn't take their medicine, and it's kind of a vicious cycle.
Mm-hmm. Mm-hmm. I understand. All right, now this is really good. Then this is a potential topic for a webinar. I believe that we need to address food insecurity and diabetes, and looking for options on how to provide the training. Again, I mean, what I'm trying to do is to develop a training based on your needs, so you don't get information that sometimes it's not that it's not useful, but probably you have already addressed the issue. So thank you so much, Vicky.
You're welcome.
Anybody else have anything to say about the patients and the needs for your patient population?
I think, what we see here, La Maestra, in regards to compliance, if it is more with our uninsured population, which is, a lot of our Hispanic population. So what we have noticed since we have been actively looking at why do we have gaps in care if we're trying to do everything, address food insecurities, education, and so forth. So one of the things that we found out is some of our patients were not completely knowledgeable on the different services that the different community health centers got to offer. So a lot of our insured patients were not aware that even if you're not insured, you could qualify for a sliding fee scale, and the medication that it will be prescribed to you will be at a lower rate. So, the patient wouldn't come to us until they were having symptoms. And then when we were asking them, we're telling them, okay, so why aren't you taking your medication? Well, I ran out of my insurance. I don't have insurance anymore. So we have taken the step of we have an after-hour group that we meet once a week with, and we make sure that we tell them about the importance of, even if you run out of insurance, just please come back to us, and then we will see how we will be able to help you, whether it's sending you to get re-enrolled in insurance or some kind of coverage, or we will be able to offer you a sliding fee scale that if you're not able to pay completely at that point, we can have a way for a payment plan for you so that you're able to get your medication. So in general, education is something that I think will be beneficial for our patients, not only about their disease, but also what other services they can have in a community health center.
All right. Thank you, Sonia. Now, Sonia, in regards to other social determinants of health, for instance, I know that La Maestra serves population from all over the world, and you have people speaking different languages and dialects. Is health literacy an issue for you, or I know that you also have homeless population that is very difficult to sometimes have follow-up visit with homeless population. So are there other SDOH, social determinants of health, that you believe are affecting your patient with diabetes?
Absolutely. I mean, transportation and housing are two things that we know affect, especially the follow-up appointments in the care that the patient should be receiving, but they just don't make it to the appointment. So in regards to health literacy, it is. I think it's not only because in general we have a diverse population. I think just in general the understanding of their disease and acceptance of the disease is something that we see across the board, especially with the newly diagnosed diabetics that are difficult for them to get. And I'll give you an example. I had my first language is Spanish, and I have all the materials that we have in English. We have it in Spanish. We have Spanish speaking providers that specializes in diabetes management, diabetes care, and even like that is difficult for the patient to understand immediately and to embrace the diagnosis and do something about it. I mean, I don't want them embracing the diagnosis and just saying, okay, I'm diabetic, I'm not going to do anything about it, but also being proactive about it. So, in regards to one that particular social determinants of health education, health literacy, it is a problem across the board, regardless of how what language they speak. We have the materials in at least the five top languages, although we do speak 28 different languages. For that, what we do is I am working. So instead of addressing it directly to the patient and through a translator. So what I'm doing right now is I'm educating the translator or our cultural liaison to be our liaison and for them to give the education to their own patient population, because sometimes they are more open to listening to somebody from their own community than a provider or a health educator that will be there just telling them what to do through a translator. So we haven't seen exactly what the results are, but what I'm looking at is a little bit more of compliance rate for the patient so that they can identify with the person they're talking to.
Excellent. Thank you. Thank you so much, Sonia. This is wonderful. Now, anything from, I don't know if Silkia is on the line. I saw Silkia in the very beginning. Are you on Silkia?
Yes, hi, good morning, everybody.
Good morning, Silkia. So, any challenges in Ponce, Silkia, that you would like to discuss, or any needs that you believe are important for us to address in the upcoming months?
Yes, as you mentioned, my population, the 90% is Hispanic, and we have a problem with the nutritional value. And in Puerto Rico, the healthy food is expensive than the garbage food. The healthy food here is expensive, and people doesn't have the economic to every time they go to shopping to buy healthy food. But we're going to establish a new program in June for the diabetic and chronic disease patients. And it's going to have a kitchen, and our nutritionist is going to teach them how to prepare the food. Because, as you say, our diet, at least in Puerto Rico, is very high in carbohydrates. We eat rice every day. It's part of our diet. It's terrible. And it's going to have a new program to teach the patient how to prepare their food and to their caretakers. But sometimes it's not the patient who prepares the food; it's their family members. Is that the new thing we're gonna be doing with them? Also, we're gonna have to field trip to buy food in the supermarket, so teaching how they buy the food. But it's a very bad situation here in Puerto Rico for the economics, so they don't have enough money to buy healthy food.
Yeah. Okay. This is really good. And what about the other social determinants of health? I mean, we've been discussing transportation, housing, insurance. I understand that Puerto Rico has some issues with insurance, right? And specifically the Medicaid program.
Right now, because of the change in the Medicaid, a lot of people in Puerto Rico, almost 200 people, 200,000 people, are now without insurance.
Okay.
And yes, it's something where we are working at right now. We have funding for that, but not for everybody. And diabetic patients are expensive patients. But we're trying to build programs. We have contact with other agencies. We're getting free medication for the patients. We've been working with that a lot. Also, we had a problem here with public transportation. In Puerto Rico, the transportation is not good. So we sometimes we use our own official vehicle to transport the patient.
Right. So somehow you are addressing the transportation issue by providing some uh, vehicles, to take the patients to the clinical site. But transportation in general is a big issue in Puerto Rico.
Yes.
All right. What about Sufol? Kathy, are you on the line? Probably she's not.
Hi, yeah, this is Kathy. I'm on the line.
Sorry, Kathy.
Fine, how are you? It's helpful to hear what everyone shares, and it sounds as though we all have similar issues. And um, we have a high Hispanic population as well. I mean, we've been offering diabetes group meetings, and unfortunately, even though we do make a considerable effort for attendance, the attendance isn't as strong as we'd like it to be. So that's been a challenge. Last year we offered an English series and a Spanish series, and this year it may be that we're just going to offer a Spanish series. Training. Well, I think we do have two pharmacists who work with our diabetic patients, and they fortunately, at least, well, I actually looked at the hypertension data. They do have, they've had some influence in getting some of our folks hypertension controlled. The diabetes, it's kind of curious to see the uncontrolled diabetics doesn't seem to nudge out of like the 49%, even though our larger population is only about 28% uncontrolled. So the pharmacists are working with high risk diabetics. And one challenge that they seem to say over and over again is the emphasis on the patients taking their meds. They have to keep reinforcing that and reinforcing it. We also recently created a one-page self-management. What are the goals that you're setting at this visit, and made it very simple with just pictures, and it's physical activity, dietary, taking your medications, and using the motivational interviewing approach. What is it that you would like to change? And that they make those indications, and then they continue to review that with them. I don't know. That's about.
Kathy, just let me ask you this question. Sometimes this is not, and do not take it just directly out of, I mean, out of my mouth, but sometimes patients need to understand sometimes the complications of some diseases, so they get a little bit, preoccupied, I guess, for their health. It's like when we had the HIV epidemic in the 80s, the people, I mean, there was a change in behavior because people were were afraid to die, and sometimes I see patients and I believe that they sometimes they think that diabetes is they understand that it's a chronic disease, but probably they do not understand the complications, all the heart issues, the kidney issues, the amputation, blindness. Do you think that that is something affecting the way that patients take medications, and they see that, there is a medication and probably I'm not going to die from diabetes? Do you think that that's something that is happening?
Oh, it's tough. I think, unfortunately, a lot of these folks, they have so many other issues. Their lives are very complicated, like we were saying, with housing, with food, with obtaining health care, all these things that, their ability to you know, recognize these when we talk about, long-term consequences. When you have so many short-term issues in your life, it's hard for you to, you know, in your mind to grasp, oh my gosh. I mean, a lot of these people come from families that there's an excessive amount of tension, or countries where, there's trauma and a crisis going on, that I think, the immediacy of talking about, well, in 10 years it could have this impact. I don't know. I mean, I'm not trying to speak for those people, but when you have a more immediate crisis to deal with, I think it's hard to discuss with people, well, if you don't do this today, next, in 5 years, potentially this could happen to you. I mean, it's a very psychological dynamic that we're speaking about.
Yeah, I agree with you. Sometimes they have to make decisions, and then they're gonna address first the most important needs, right? I totally agree with you. I totally agree with you. But I was curious because in order to make behavioral changes, I believe that takes time, and that you've been talking about motivational interviewing, but I also understand all the other factors, social and economic factors affecting the diabetic population. I completely agree with you. And thank you so much for the feedback. Now, in regards to the um, the training that you would like to receive, I mean, we provide different kind of trainings like this, conversation, like online conversation over the phone. We have webinars. We have conferences, either regional conferences or a national event. What is the best vehicle, or what is the one that works best for all of you, in regards to training? Do you prefer to have a webinar? Would you prefer to have a conversation like this one? Or if there is a training from, let's say, the American Diabetes Association on treatment protocols, is that something that you would consider and attend either a regional or a national conference? What is, I believe the question is, how would you prefer to have this training activity?
For us, I think that regional is kind of the ideal, as far as face-to-face trainings. I think that regional is ideal, but web conferences and things like that are really good too. So.
Okay, all right, thank you. What about La Maestra, Sonia? Anything that you prefer?
I'm sorry, can you repeat the question?
Sure. The question is, what is the best vehicle for you to receive training? Either these kind of conversations or webinars, or sometimes we do regional conferences or regional trainings, or not, or a national event, or all of the above.
I think, well, all of the above, definitely. But, to be honest, it is because of, personnel and manpower and time, which are, I think, areas that we all struggle with in community health centers. I think webinars and conversations like this are the better way to be able to, for me, to get my ancillary staff and, in a room, so I can kind of block an hour or so for them to be able to participate in these webinars. For providers, going back to the first conversation that we had with Vicky, for providers, I think definitely, just going to presentations where, they can get CMEs. Absolutely, that's something that will be good. And for nurses, where they can get CNEs. So those are definitely driving forces where they may be able to use.
All right, that's really good. And that reminds me, I have something that I received from the American Diabetes Association. These are some. I mean, They are offering some live trainings, and they have regionals. They have different uh, regionals across the nation. So I'm gonna send after this call all the topics that they are covering. In case somebody is interested, let me know. We can get some discounts. The other day we got some discounts for some health centers in New Orleans. They were offering this training, and then that you were mentioning the CMEs and CNEs, they offer CMEs and CNEs. If I'm not mistaken, this is a 1 day or 1.5 day training. So this is great. Thank you. Thank you, Sonia. And in Puerto Rico, Silkia, I believe that for you guys it's better the webinars, right? And the conversation
Yeah,
over.
we would like all of the above, but we have both a way of re-educating our staff. The physician we like to have them with the face-to-face education. For the
Mhm.
nurses learn more, the webinars are better.
All right, and probably you cannot answer this question, or at least you cannot make a general statement. But if not in Puerto Rico and you have to do it in the U.S. territory, I believe that probably Florida is the closest one, right?
Yes.
Okay, excellent. All right. And what about Sufa, Kathy? Anything in particular? I believe that you and I discussed the other day that regionals are a good option when we offer live training. Am I correct?
Well, the concern is having time to work, you know, with these folks. So things that are on site are better than if people have to travel because it takes more time. There's travel expenses. Also, I think when we're teaching, if we're directing the training towards medical assistants, I think it's better to do it in short intervals, not like necessarily a whole day from 9 to 5, because it's a lot of information. And I think short intervals, we have a better attention span with these folks. And I think as practical as it can be is best,
Mm-hmm.
rather than necessarily theoretical or this is what the research shows us, like these are the actions. This is, things like that. Um,
Excellent. Yeah, and
so
you're totally right. I mean, that's one of the challenges every time that I talk to different health centers, the time, and lack of sometimes you need to add training to your budget, and you cannot leave, the site for 1 day or 1.5 days. So those are the challenges, even though and sometimes the live trainings are I mean, you receive the most current information, I guess, and sometimes is useful, especially as it was mentioned if you offer CMEs and CNEs, because at the end, physicians and nurses are looking for that kind of training. So the last question that I have, and I wanted to touch a little bit on phases of diabetes care, but probably we'll leave that one for another occasion since we are very close to the top of the hour. But the last question that I had in this kind of a short survey that I wanted to discuss with you is, in addition to diabetes, what other either chronic medical conditions or any um, other infectious disease or any other disease that you would like to receive training, either any of the performance measures, the clinical performance measures that you work on, or any emerging issue. As you know, measles, for instance, is we're having a really bad outbreak of measles, and immunization is becoming a big problem for some people who are against vaccination. And one of the concerns is now all the outbreaks and problems that we have. For others, probably cardiovascular disease or heart disease is an important topic. So, in addition to diabetes, what other either chronic issues or a medical issue you would like to receive training on?
Dr. Leon, this is Sonia from La Maestra. I just want to make sure that when we're talking about diabetes, we're including pre-diabetes as well.
Okay, yeah, that's
Because
really good. Yeah.
Yeah, because that's one of the areas that I know a lot of our providers are a little sometimes skeptical to utilize the correct ICD-10 code for a patient that is clearly pre-diabetic.
Mhm.
I think kind of giving them, the providers specifically, a little bit more tools on why not, what's the best practices and so forth, and also tie the pre-diabetes with obesity and other social determinants of health. I would like to see that within the diabetic. I don't know if within the diabetic, but I would like to see that being addressed if that would be possible.
Excellent, excellent. This is really helpful. Thank you, Sonia. So it's basically include a training on obesity and pre-diabetes. Any other issue that you're seeing that is affecting your population, Sonia?
We
Opioid
are
management.
seeing. Oh, sorry. I'm sorry. We're seeing on the same token. Something that we're seeing is also an increased number of patients with a diagnosis or with signs and symptoms of NFLD and NASH. So if that we could have the same kind of conversation around all that, I think that would complement each other very nicely.
Excellent, great. Thank you so much. Who else wanted to chime in?
This is Vicki again. Sorry. I was just going to say that one of the things that we are really focusing on a lot here also is the opioid management, the pain management type stuff, because we're seeing tons of patients that are coming in who are wanting to receive pain meds and that kind of thing. So we're doing a lot of work here on that, and any insight that we can get is going to be helpful.
Okay, so this is opioid and pain management. Okay, excellent. Thank you so much, Vicki. What about Puerto Rico, Silkia? Anything in particular in addition to diabetes?
Yes, we're having problem with people accepting the flu vaccination in here, even adults and pediatrics patients, and the cardiovascular disease that come with diabetes.
Okay, so this issues on flu vaccine and on heart diseases, right, in the diabetic population.
Yes.
Excellent. What about Zulfa, Kathy? Anything else?
Well, there's always something new happening. I mean, yeah, we are addressing the measles issue. We're also involved in the collaborative with the Million Hearts for prescribing statins, for diabetics, depending on their LDL levels and others who have been identified with cardiovascular disease. So that's a high priority. We work on, I could name a number of things. HPV vaccines. We're right now doing a project with dental and body mass index for young children. I mean, it's always things popping in. I mean, risk management, ongoing work with that. I mean, there's,
Excellent. This is very helpful. I appreciate the feedback that we have received today. Is noon, basically here in the DC area. So I want to be very respectful of your time. Had other issues that I wanted to talk, but this is going to give me the opportunity to work on different training and technical activities for the next program year. So I appreciate all the information, your participation, your support, and everything that we receive from the participants. So thank you so much for your help, for your support. And whenever you have any training or technical assistance need, you know how you can contact me. You have my email address, my phone number, and I would be more than happy to be in touch with you. Thank you so much and have a great afternoon.
Thank you, doctor. Thank you very much.
Thank
you so
you. Bye-bye.